Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, and today I'm joined by Gary Morrison, who is the VP of Employer Sales at Lark. Hot topic is GLP-1. So why don't you tell us a little bit about what you're seeing with that and what we could be seeing with that in January of 24?
There are a number of different programs to support employers of various needs. What we're finding is that everybody is approaching these drugs differently, but everybody is dealing with the same issues. The first being the fact that they're incredibly expensive. These drugs are running about $10,000 to $15,000 annually, and we know that 42% of American adults are obese, and so there is a very large portion of the population that could ultimately benefit from these drugs. Obviously, if you greenlit these medications for everyone who qualifies as obese, that would increase spend by about $1.2 trillion. So that's something that is not reasonable, and employers certainly can't accommodate. But at the same time, they are showing incredible clinical effectiveness. The average member is reducing BMI between 15 and 25%, which is unheard of. And at the same time, recent studies are suggesting that it's impacting chronic conditions. Members who were on these drugs were 20% less likely to have stroke, heart attack, or die.
It seems like the line that Lark is trying to help people walk is making sure that members who need these prescriptions are getting them because they are having remarkable results on them, but adhering to them.
Our goal is to thoughtfully support members and employers before, during, and after the medication. And the way I would distinguish those three is that we do have a weight management program that is significantly reducing member BMI. And so before you start someone on a medication, you can use our program to improve their health and wellness activities so that they can naturally reduce that BMI and not need the GLP-1 medications. Secondarily, those who do need the GLP-1 medications, we are providing very important medication adherence and lifestyle coaching. And the reason that we found so many employers excited to incorporate this companion model is because a recent study showed that 1 out of 3 members was still taking these medications after 12 months. And so that's a really incredible financial investment for employers to be making for only 1 out of 3 members to continue to use them and see the impact of these drugs. And so the intent of the companion is to help people deal with uncomfortable side effects and really support them in between their doctor appointments with medication reminders and support.
Thank you so much for being here and sharing all about Lark and GLP-1. Really appreciate your time. Thank you so much.
Thanks so much, Stephanie.